Welcome to Advance with MUSC Health. I'm your host, Erin Spain. This show's mission is to help you find ways to preserve and optimize your health and get the care you need to live well. A health screening tool called DARI Motion Analysis System is being offered to patients at the MUSC Health and Wellness Institute. It uses the power of video cameras and motion data to objectively measure how efficiently you move. From there, you may be prescribed targeted strengthening exercises that can help you meet your health and fitness goals. Michael Soul, a human performance manager at MUSC Health, is here with details of this system that can help high-performance athletes and everyday folks. Welcome to the show, Michael.
Hi, thanks for having me.
First, tell us about the MUSC Health and Wellness Institute. It's fairly new, and some listeners may not be aware of it and all of its offerings.
Yeah, we've been open for a little over a year and a half now, and I would say we take medicine to the next level for MUSC, and not just sick care, but in the wellness space. So how do we get ahead of ourselves before we get sick, and how can we prevent that? And I think that's the next step in medicine, and that's where kind of athletics has your traditional medicine, I would say, just like a step ahead, because they're very proactive versus reactive due to, investments in players and really everything else of the aspect of sports and how they take care of their athletes. So the idea of the Health and Wellness Institute is try to take that concept of great healthcare for an athlete applied to general population and our current hospital patients as well. So that way we could better support not just athletes, but the whole community. And I think that goes to say we all kind of view ourselves as athletes now, right? We like to use data to tell us how our health is, whether it be everything from steps to our sleep scores. And I think that's something else that gets hidden in sports is the recovery and how players go day to day throughout the rigors of a season. But we could take that season and that's just a microcosm of our lives. So how do we prepare our lives for, hey, I have a big family event coming up. It's going to be a long weekend. I need to make sure I get my rest or I'm feeding myself well. And that's where it touches upon the Health and Wellness Institute, where we cover exercise, nutrition, and then mental health / mindfulness, I would call it. And we like to use those three pillars as, a comprehensive, integrated way to go about medicine and really capturing the longevity of your life.
You've mentioned athletics during this conversation already. You're a certified athletic trainer and strength and conditioning specialist, as well as I mentioned, a human performance manager at the Institute. You have a lot of experience in athletics. Tell me about that experience and why you decided to come to MUSC Health.
My undergraduate degree is in specifically athletic training. I went through my board exam, and then my master's degree is in health promotion and fitness management. I interned with the New York Yankees minor league system. MUSC was the medical provider for the Charleston River Dogs. So I built a relationship with the physicians and some of the physical therapists. And as I moved on throughout my career above the Charleston level, I decided that I wanted to kind of, get out of baseball and see where else this profession could take me. Athletic training certainly lends itself more towards the sports arena, but I think something that's really nice about the profession itself is now we're expanding our roles as athletic trainers to hospital systems, to roles I'm in now. And it's not just seen as those are the folks that run onto the field when someone's injured, but now we could take that to, well, how do we help the geriatric population with whether it be fall risk, or how can we give them exercises to improve their bone density? How can we help them with joint replacements or create better outcomes by making them stronger? Or in your traditional sense of physical therapy, how do you take it to the next level, right? Once you finished, you're usually pretty functional, but sometimes you're striving for that little extra bit of how do I get back on the court, or how do I now prepare myself to run another marathon or a half marathon?
How critical is it for athletes and people who just want to improve or maintain their fitness to understand how their body moves and possible movement limitations?
So athletic training is really an orthopedic-based profession. So looking at, ankle sprains and then the rehab process from there of how do we get you back on the field. And that's one reason why I sought out the strength conditioning certification, so I could put the fitness piece together with it, but then also work in concert with the strength and conditioning staff. So that way there was a bridge between medicine and getting the athlete or anyone stronger, but making that a good transition and a good bridge from those rehab type things to now something more functional on the field, or something you might do in your activities of daily living or back at work if you have a very labor intensive job.
The DARI motion analysis system at the MUSC Health and Wellness Institute is the only place in South Carolina offering this service to the general public. Tell me about this system and why MUSC Health decided to bring this to the Institute.
I think they saw a similar vision that I did, where we have a chance to bring something that's innovative to the population here. We can really use it in every sense of the imagination. We could use it from, youth athletes. We have the ability to mark down what's the throwing motion look like and evaluate people's throwing motions. So that way we can reduce the risk of injury. And that was one of my main goals of coming here to MUSC, was to educate people. I felt like, with the exception of working with professional athletes, when I worked with recreational athletes, or I'd be talking to some of their parents, there was so many questions that I felt like they were misinformed about, because there is so much information out there. It's hard to navigate the waters, and everyone is unique too. So you kind of need a professional opinion, because all of our bodies are unique. Therefore, how we move is unique, and so on and so forth. So that's why I think the DARI is great, because we can use it from the youth to the aging population to really anything. And I like it because in one day, I'll see someone who's a surgeon, someone who likes to play pretty competitive tennis, and then I might see somebody who says that they want to get ready because they want to hike Europe. And they're like, I haven't done it in a while, but I want to make sure that, I'm investing this time and money into this trip. I want to make sure I do it well, or it's something I've been really wanting to do with my family. So it's not just the achievement of your body feeling well, but then also the achievement of these folks from their own personal goals.
I want you to walk me through how the system works, the process, what it's like for individuals who come through. It's important to note this is a non-contact system, so there's no wires or gadgets hooked up to you. Walk me through the DARI motion.
Yeah, so traditionally we'd have to put markers on people, like the little dots you see when they make Avatar and Lord of the Rings. It's kind of like CGI type images. With this, it's markerless, which saves us countless hours and picking up the little markers when they fall off. So we have 8 cameras, and what you'll do is you'll step into the ring of cameras, and it'll do a scan of your body through the cameras. So that way it picks up different points on your body, and it creates a skeleton or an avatar to lay over you. That's how we know that everywhere that you move, the cameras are then picking it up. I'll then go through a number of different exercises or balance tests that are specific to that person, athlete, age group, whatever, our intent is for that session or consultation. And we'll predetermine some goals beforehand, and that kind of helps guide us in the motion capture aspect of it. Once we collect our exercises, our balance test, DARI will then tell us, what are our top 3 priority areas? And it judges that based off of how well did we move each joint of our body through each motion. And it compares it to normative ranges of those joints, based on the literature. So we like to fall within the range, but I think it's also important to know, too, if we're not in that range, how do we get back there? And the second piece of it is, what's the compensation for that? Because that helps us solve the puzzle of maybe why this person has discomfort, or maybe why, it's difficult for them to perform some activities, but they get there. And how do they get there? Is they compensate. And we all compensate, and we figure out ways to get from point A to point B. And there's some nice printouts that help, again, make this much better to look at and digest and understand ourselves from the general public's point of view.
And you're able to hold on to that data and then kind of track progress over time by doing more of these analysis down the road.
Yes, we like to test and retest to make sure the intervention that we put in actually worked. And if not, why didn't it work? The neat part about it is we can do it at a certain time. Let's just take like a sports team, for example, and do it in the fall, and then the next fall do it. But you might have that player for 3 or 4 years on your team. And now you can track a trend for them of, hey, each year we notice this person's losing X amount of range of motion in this body part. Is it vital to that sport or what they do for work? Yes or no? I like to view it as a piece of the puzzle, right? It helps you make more informed decisions. It's by no means telling you how to do certain things, but it points us in the right direction. And I think it brings up some good questions.
Do you think it could also uncover a movement disorder?
I think it could help people shed light and be more cognizant of how they move. And if we can understand how we move, then I think we're more prepared to be able to fix it. And the more in tune we are with our bodies, I also believe the healthier we're going to keep ourselves too.
Tell me about some of the success stories that you have seen both in athletics and maybe folks who are in the hospital population.
My favorite one is a surgeon came in and she does a lot of robotic surgeries, so general surgeries, but she was talking about how she wants to get into better shape, but she's also starting to have some numbness and tingling go down her arms and some negative effects of the posture she has to be in for such long periods of time based on the ergonomics of the robotic apparatus she has to use. So it's been a good 3.5 months or so with using the DARI and kind of looking at her posture mainly and how do we adjust her posture to now working. And we had her take pictures of her inside the robotic apparatus too, so that way I could get a sense for what it looked like because I can't be in the OR. But through some of the numbers we got on the DARI, looking at her posture, we helped loosen up some of the musculature in, the upper part of her chest and in her neck. And now she's much stronger. And we also worked on her core too, which a lot of people probably wouldn't think makes sense in that case. But because it improved her balance and she was able to get stronger and work out more, all those things in combination with each other. So she's got better grip strength now, which is huge because when they use the robotic apparatus, you have to use your pointer finger and your thumb in order to move it around and get the small areas of the body. So she doesn't have any numbness and tingling there. She has improved strength. And she's like, my headaches in the back of my head, if they do happen, they're very few and far between and they're not as intense because we kind of repositioned her, for that to happen. So that's a story where we use that as a piece of the puzzle, right? Like we know something's wrong and we have a general idea, but let's try and pinpoint this. And I think that's the missing key is we can use this for general things and maybe I see it, but I can't communicate it accurately to the patient, let's say. So we can show them on the DARI, hey, this is what's happening. But now we can also go through with like a fine tooth comb as well and say, if you move your shoulder blade this way for this period of time, that might help. Or if you look at it from an athletic point of view, you might be able to clean up somebody's mechanics, which might not only lead them to a decrease in injury, but also might improve performance too. That's a larger piece of the puzzle with that. I just had a client and when she first came in, she had an ankle injury that was pretty severe. She had surgery, she'd gone through PT, but she was still having some chronic strength and instability issues. And with that, it was negatively affecting her tennis. And she loves to play tennis. She's played it all her life. It's essentially like her outlet. So now we're getting into how does that affect this person mentally as well. And it started her off like somewhere in the 20s. And after we're going on month 3.5 going into 4, we took another scan and she was in the 40 percentile. So she made significant improvement. And she's like, my tennis coach has made comments. She's like, I'm hitting the ball better. So we take her to the next level because she's not where she used to be and that's where she wants to go. That was really neat too, to see her progress of that, but then also to see the enjoyment of her seeing the results pay off. We can increase a weight here or improve someone's balance, but it's not as enjoyable as when they hit a good shot on the court and things fall into place for them.
You've mentioned things like changing posture, weightlifting, working on your core. Walk me through some of the plans that you have with patients after they go through the DARI system and they realize what they need to work on.
The way I like to create the programs for all the clients is address it of how do we make something that's digestible for them? And by that, I mean a good time for them. If they're not going to be completing it with me and someone's going to do it on their own, time is a big issue and making it conducive to their schedule. That's priority number one for me, honestly, because if we don't have compliance, then we don't do anything. The warm-up essentially is corrective exercises, I like to call them, or, warm-up exercises, but they're specific to that person. So if someone shows that they might favor their left leg versus their right leg in terms of mobility, let's say, then in that warm-up, I'll put an exercise that either balances that out or maybe helps to promote the other side. So each person's warm-up is unique to them, which goes a long way. And then we address core. When I say core, I don't mean like our six-pack, because that's not truly kind of what indicates how well we hold our center of mass and our balance. It's those deeper muscles, our obliques, and some of the transverse abdominis in there as well. So the idea is if we can build endurance through that, that's going to help with our posture because that's the center of our body and that's where we hold our center of mass. So those two things are incorporated in the beginning. And then we look at, okay, we kind of go joint by joint and what's this person really need. So if we need to improve general lower body strength, A squat would be great, but the key is, well, does this person have a previous history of, let's say, low back injuries? Well, they don't need to put a bar on their back. How can we make this exercise for this person attainable and successful so that way they don't walk away in pain or discomfort? And that's, for me, the beauty of it all, because now I know from gathering data from the DARI, seeing the person walk, looking at their posture, where do we put that weight on that person? Me, you, anybody can do a squat, but I might hold it in front of me here. You might hold it on the side. There's different ways to go about the same exercise and achieve the same goal without putting this person in pain or without making it a very cookie cutter type fashion. And for me as a clinician, if I can incorporate the gait or the walking motion into a lot of the exercises, that makes it more functional for people because it helps make sense of like, okay, when I go to take this step, I need to be strong here so that I don't fall. So always reinforcing, we're going to do this exercise because it's going to help with XYZ. Or, hey, you saw on the evaluation, you got this number. We're going to do this exercise so that way, the number that popped up on the DARI in this category improves because we know that you're more stable.
So getting access to this DARI system is part of packages that you offer at the Institute. Tell me about some of these offerings and how people can learn more.
Yeah, I would certainly visit our website. And we say the packages work best because what happens is you'll come in for a consultation. You'll meet with myself or one of the other providers based on the specialty that you picked, whether it be exercise, nutrition, or mindfulness. But sometimes throughout the evaluation, we find out, you might need exercise and nutrition, and that sounds like a good idea. So then we'll make a package just for that person of exercise and nutrition together, but they might need more exercise than nutrition. So we'll balance out their visits.
Are these packages available to people of all ages?
Packages are available to people of all ages. Throughout my day, I see people in their teens to their 80s and anywhere in between.
How unique do you feel this institute is, not only in South Carolina, but in the country?
It's something that I find to be unique, and it's kind of been a dream of mine to create for people because, as an athletic trainer and talking to other people in my field, we need something to educate the public, but they don't need something formal, right? It's always difficult to get doctor's appointment, to go through the formal process of things. So if there was kind of like this intermediary space for them to go and get a good resource, and then also learn about themselves and work through exercise and nutrition, for me is very unique. And almost all of our services are offered virtually, which is great as well. The only thing would be, unfortunately, the DARI can't be virtual, but if you were to come in person to get the initial evaluation, then we could do all the follow-up sessions virtually and such too. So I think that's also something nice. Even if someone's just visiting, we could still work remotely.
What do you do to optimize your health and live well?
Honestly, I've gotten into a lot of posture and breathing within the last few years. I just turned into my 30s. I feel like I'm getting old, so I'm like, I can't do powerlifting anymore. So what kind of exercises do I do that are like good for my body and to stay healthy? So a lot of it's core body weight exercises and not so much like deadlifting hundreds of pounds, but certainly more core oriented exercises that are going to work on endurance, but then also how to breathe through all that. And I say that because if you can breathe through an exercise, then you've mastered that motor pattern or that exercise. So how can I become the best at a certain exercise?
Well, thank you so much, Michael Soul, for coming on the podcast and sharing all the exciting work that you all are doing at the MUSC Health and Wellness Institute. We appreciate your time.
Thank you so much. I appreciate it.
For more information on this podcast, check out advance.muschealth.org. Welcome to Advance with MUSC Health. I'm your host, Erin Spain. This show's mission is to help you find ways to preserve and optimize your health and get the care you need to live well.